So we examined the recent electronic medical records of patients at a large dialysis organization for stated reasons for discontinuing phosphate binders. So we had over 30,000 records that we looked at, and we classified the reasons into a number of broad categories. Well, many of the, over half of our records had no specific reasons. We did find that about over a quarter of the reasons related to lab results, and about 10% of the reasons related to patients not tolerating the specific phosphate binders. When we looked at the percentage of patients, when we looked at the patients who did not tolerate the phosphate binders by the different binder types, we see in our total sample this was the distribution of binder types. But among the patients who didn't tolerate them well, we see that lanthanum carbonate was overrepresented in a number of these categories in patients who reported GI upsets, patients who just simply refused to take their phosphate binders, patients who couldn't chew or swallow the pills, and allergic reactions were normally distributed given the overall distribution of phosphate binders. So in a sense, this is just the first stab at the data. We're looking at what we've taken away from this is that given the number, this is electronic medical record, so we're repurposing data that already exists, but given the number of that 10% of the patients' primary reason for stopping phosphate binders was due to their inability to tolerate them, and we suspect that the number is actually a little bit higher than 10%, and that still there is work to be done in making phosphate binders more palatable to patients to help increase their likelihood of staying on regimen, and so that they can continue to receive the benefits of taking the phosphate binders.